Hello, Dr. Suman Garu. Welcome to Pilupu TV. We are in the East Coast, and not only East Coast, these days, even Texas is getting snow. We would like to know your expertise and ask you a few questions about the coming winter storms and about extreme weather conditions and how to handle them.
Thank you for inviting me. My name is Suman Manchireddy. I'm a practicing physician, internal medicine and obesity medicine in Northern Virginia. Um, yeah, I've been in medicine for more than 20 years now.
Thank you, Dr. Suman Garu. So, what precautions should individuals take before starting snow removal, especially in this cold weather?
Yeah, I think before answering that, I think we need to step back and understand what's going on. Pathophysiology, or how this thing works, is that um, the cold and also the severe condition that we are going to face, with the snowstorm, it increases the blood pressure. It increases your vasoconstriction, we call the blood vessels kind of really tighten up because of the weather conditions. And when that happens, the exertional, when the heart starts to increase the blood pressure, that's when the heart events happen. So what happens is when weather events like this happens, you are exposed to the cold, okay, and that increases your blood pressure, that causes undue stress on your heart, and then the heart attacks happen. So to understand this, uh, before we go to the how to take care of it, is very important. So when you are snow shoveling, when you are in the actual phase of snow shoveling, you're moving your arms and upper body a whole lot. So there's a lot of blood flow happening in your chest area, and also you're using upper body muscles. You're not using your lower body. So that what does that do is that when you're shoveling the snow, it puts undue pressure on your heart. Okay, that's one thing. Second thing is there is issue with the cold weather that also increases your blood pressure. The third thing is when you're standing still, the blood pools up in your legs. So that's also when the blood is not circulating, it gives undue pressure on your heart. Then the fourth also is that when you're lifting the snow, it increases pressure of your chest. So when you're trying to push the snow, you're tightening up the chest, and that also increases the pressure. So there are different ways that acting on your heart. And when this happens, if you have a condition of heart disease, if you have a condition with blood pressure, blood sugars, inflammation, obesity, all these conditions can give rise to heart attack. So what we need to do is to wear nice layers and make sure you're warm enough. And the second thing you need to do is when you are shoveling the snow, don't lift the snow, try to push it away. Especially when it's very, very cold, you need to cover your mouth and the nose so that the cold air doesn't go in. And also try to do a little bit of warming up, like just because you go do an exercise, right? When you're running or something, you want to do some stretches, you want to walk a little bit, you want to do that before you head over and start to shovel. Always take breaks, and this will help your heart to stabilize and optimize before actual snow shoveling. Make sure you don't have any of these five conditions. Like I said, the heart disease, if you have a previously heart patient or heart attack patient in the past, or at risk patient, you don't want to do shoveling because that increases the heart risk. Second thing is blood pressure. So the blood pressure really goes up with the cold weather. So that you don't want to do. And then diabetes and elevated cholesterol, they have undue effect on the heart too because of inflammation. And that could raises the chance of heart disease. Obese patients also have increased inflammation. So they also increase the heart disease. So all these conditions, when patients have elderly gentlemen, you don't want to just go and shovel the snow. So you want to take time. I would not suggest for these folks to do the shoveling. They should seek help.
Oh, that's excellent. Thank you, Dr. Sumanga. That brings us to our next question. What are the warning signs that indicate someone should stop immediately and seek medical help while shoveling snow?
Yeah. So when they are shoveling snow, they should watch for any signs of chest pain, chest pressure, chest tightness, breathing problems, dizziness, nausea, cold sweats, anything to the left arm, pain over the left arm. All these signs tells us that there is a high demand going on for the heart. And when that happens, you want to seek immediate attention and go to the ER. Don't go to the urgent care. Don't call your doctor. Just go to the ER, because timing of the essence. When somebody is having the blockages, they have to go and fix it right away.
Thank you, Suman Garu. That's really excellent. I think you got out very good points in this. My next question is: many people rush to finish snow clearing quickly. What advice would you give about taking? You already told that you need to take breaks and pacing during the work, but what would be an ideal taking breaks? Is there any ideal time or
So what they have shown is that in just 2 minutes, your heart rate races up to 80% of heart rate, when you're on treadmill, right? So it goes by every 3 minutes, it goes to hit 80% of heart rate. That's almost like, 10 minutes or 12 minutes. But shoveling snow, within 2 minutes, your heart rate goes up. So imagine, you're shoveling, and especially what they've shown is that people who shovel snow like 7 2 inches or above, they are the ones who are more prone for, issues with the heart, because you're moving large pieces of snow, and that can put undue pressure on your heart. So I would, make sure that, they are they do it very, very slow, and if they have to really do it, they make sure that, like I said, multiple layers. They want to take breaks. That's what this study showed. I mean, imagine if 2 minutes to 10 minutes, your heart rate is going so high. Obviously, the demand is higher, and then the heart can't take after, especially if you have a disease and something, and you can end up, having serious consequences. So at least 5 to 10 minutes, take a break with heavy snow. If it's a light snow, it might prolong it a little bit. But again, you have to figure out whether you're at risk. I laid out all those conditions, and you have to be extremely, extremely careful.
Thank you, Dr. Suman Garu. I think this is first time that I'm knowing that, snow shoveling, you should really watch out for your heart. Thank you so much.
Yes, especially coming to the Indian background, South Asians are prone for heart disease. So we have to be extra cautious and, take it easy, seek help. I know it might be a little expensive to somebody else to clear, but do not, always heed caution.
Who should be extra cautious or avoid shoveling altogether? You have explained this very beautifully. Thank you so much.
No problem. You're welcome.